Hi, I'm Kate Wallace from the Division of Developmental and Behavioral Pediatrics and Policy Lab at the Children's Hospital of Philadelphia. I'm excited to talk to you about our paper focused on referrals made in response to a positive developmental screen in primary care pediatrics. To aid in the earlier identification of developmental delays, the American Academy of Pediatrics recommends ongoing surveillance in pediatric primary care with targeted screening with a validated tool at 9, 18, and 30 months. Using a validated and systematic screening tool increases the recognition of developmental concerns. If a child screens positive, the AAP recommends referral both for early intervention and for additional evaluation to assess these developmental concerns. One additional goal of surveillance and screening is to improve the equity of identification of and intervention for developmental issues among children from traditionally under-recognized groups, including children from low-income families, those with non-white race, and girls. Prior data demonstrate that children from Black and Latinx backgrounds and girls are underrepresented in early intervention. It appears that these disparities in early intervention receipt persist despite increases in the use of screening tools. Therefore, our group decided to investigate if the additional step of referring after a positive screen might be contributing to these disparities in receiving early intervention. We asked whether referrals made in response to a positive developmental screen varied among boys and girls and among children from varied racial, ethnic, and income backgrounds. We accessed data on screening and referral from the large primary care network at the Children's Hospital of Philadelphia, which screens all children at 15, 18, 24, and 30-month well visits using the milestones portion of the Survey of Wellbeing in Young Children, or the SWIC. Our final sample included 7,358 children with a positive developmental screen. We categorized referral data into the following outcomes. 1, whether a child had initiated early intervention prior to that screening. 2, whether a child was referred to early intervention on the day of the screen. Or 3, whether a child was not referred to early intervention. We compared demographic factors associated with each of these referral outcomes. We found that among children who screened positive on the SWIC milestones, 18% were already receiving early intervention. These children were more likely to have lower scores on the screen, meaning greater delays. They were more likely to be older or of white race compared to Black or Asian race. An additional 40% of children were referred at the visit with the positive SWIC milestone score. These children were more likely to be older, be male, to have public insurance or live in a lower income neighborhood, or be Black versus white. The remaining 43% of children were not referred to early intervention, either prior to or on the day of a positive SWIC milestone screen. In most of these cases, the decision about referral was deferred until a later date. These results indicate that some traditionally underrepresented groups, including Black children and those from lower income backgrounds, were referred to early intervention as a result of their positive screen, while white children were more likely to have already begun an early intervention at these young ages. To us, this important finding suggests the value of universal, systematic screening in helping identify children who otherwise wouldn't access developmental intervention. The major limitation of this work is that we do not know the ultimate diagnostic outcome for children with a positive screen or whether children who were referred ultimately qualified for intervention services. We also do not know what other factors may have influenced pediatricians' decisions about referral. We hope to examine these remaining questions in future work. We hope that our findings can help inform processes to increase and improve referrals of children with a positive developmental screen. Thank you.